All right, welcome. How are we doing today?
I'm okay. I'm good.
Yeah, okay. All right, that sounds good. Um, hey, I forgot. I don't know if Melissa told me because we didn't write it. Where exactly are you from?
Where am I from?
Yes.
Oh, I'm from Watertown.
Oh, nice. Okay, good, good. Um, so what are we doing today? Is there something you would like to talk about?
Um, well, I've been having a lot of anxiety
Okay.
because I'm in the master's program
Oh, okay.
and I'm getting ready to graduate. And now I'm starting to get really nervous because now I'm going to have to start paying my student loans, and I've been in school for so many years, and now I have to find a job doing what I went to school for. So
Yes, yes.
it's my anxiety is really high because I have a daughter, so and I'm single, so I have to be able to provide for her. Plus, I work as a substitute teacher, but I don't like that. So
Okay.
that's why I decided to go back to school and get my education so that I could get a better job, so I could provide for myself and my daughter.
Okay. Okay. That's wow. That's great. That's really good. Yeah, when it's time to upgrade, it's time to upgrade. That's really good. Really good for you.
Thank you.
Um, yes, I remember those days when I started looking for a job and whatnot. After I graduated, it's it's easy to get nervous and to get anxiety in that situation. And if I heard you correctly, you said you're trying to find a more stable job, a job that you like, because you said you didn't like the teaching job, the teaching position.
Yeah, I
Are
don't
you are you thinking of working for the school, or is it something completely different?
well, I'm getting my master's in social work.
Okay. Oh, nice.
So I
Very
would
good.
be, and then I want to get my license because there's more opportunities once you're a licensed master social
Yes.
worker.
Yes, this is true.
But yeah, I'm just nervous about being able to find a social work job and in a place
Sure.
where I like, because I like helping people. So that's why I chose to go
There
into
we
this
go.
profession.
That's very good. That's very good. You know, helping people is great, but we can't forget about self-care. That's very, very important. I don't know. I don't. You say you've been studying for quite some time, and you have been working for quite some time before that. Um, Sometimes when we don't take care of ourselves, and it shows in different ways, it may come up how you least expect it. Let me ask you.
Yeah.
You mentioned that you feel anxious. Um, do you feel like you get irritated easily?
Yeah.
Yeah.
I, yeah.
Okay.
I
Okay.
don't like, I get irritated easy. I'm not, I don't really eat, um, because my stomach just is in knots. I don't sleep well. So,
You don't sleep well? No.
no.
Like how many hours at a night would you say you sleep?
I don't really know how many hours, but I toss and turn. I get up at least 3 times every night.
And when you get up, how fast do you get back to sleep?
Not very fast. Like,
No, it takes you a while.
I toss and turn. I can't get comfortable. And then when I start to fall asleep, then my alarm goes off and I have to get up and,
Yes, of course. Have you tried any medication for sleep?
no.
No. You haven't talked about this to anyone before?
No.
Okay.
I don't go to the doctor very often.
No. Well, I understand. Sometimes we don't have time, but you see, that's part of that self care that I'm talking about. Very important.
Yeah.
And missing sleep, it's actually not great because when we don't sleep enough, the chemicals in our brain don't quite work the way they're supposed to work, and then we start getting we can fall asleep during the day. We lose to pay attention in the things that we're supposed to pay the most attention to. Just things that happen. Let me ask you, how are you coping with this? What are you doing to deal with this kind of, like, with your lack
Um,
of sleep, or when you feel anxious, or when you're irritated? You said that it's easy for you to get irritated.
I don't really do anything.
No,
Um, no, I just push it down.
push it down. Okay. Well, let me tell you, there are pros and cons, right? Pushing it down basically is like numbing. And the thing about feelings is that you can't just numb one of them. Unfortunately, when you numb one of them, it applies to every single one of them. So, and we don't notice it right away, but when we push things down, they tend to come up in other ways. You know, the kettle, right? A tea kettle. You
Mhm.
know how it builds up the pressure, and then it has that steam valve that sounds, that noise that it makes, is when the steam is completely full, and then it's done. When we push things down, we don't have that release, so it keeps building up. And usually, when things like that build up, they tend to explode, and then they come out in ways that sometimes are out of our control. Out of our control.
Yeah.
Um, well, for one, you're not being judged here. So I want you to feel as comfortable as you can. I want you to know that whatever we talk, it's going to stay within you and me. Okay.
Yeah.
There are certain things, there are certain exceptions, like everything. If you tell me that you want to hurt someone, or you want to hurt yourself, these are the things that I may have to disclose, but they're for your own safety.
Yeah.
We
No,
understand?
I don't wanna hurt myself or
Okay, good.
anybody else.
Good.
I'm just I just thought it was time I come and see a therapist to, um, figure something out
Yeah.
to help me. Um,
Okay. See, and that's the important thing. When the first thing, the first and most important thing is recognize where we are at, and then go from there. And sounds like you did the right thing. You realized you needed some help, and here we are. That's excellent. That's excellent. Um, Let me ask you: have you ever heard of wellness, meditation,
yeah.
wellness meditation? Have you ever tried that before?
No.
No. Well, I think this is something that you could benefit from. Do you ever have time for like 5 minutes, 10 minutes, maybe 15 minutes for yourself that you can find during the day at whatever point during the day?
Probably. I
Yeah.
could probably find 5, 10 minutes.
Okay. So excellent. That's a good start. See, what I want you to start doing is to sit down for those 5, 10 minutes that you can and try to relax. If you have like, if you feel anxious or this is separate from those 5 or 10 minutes. I want you to count things around you. You know, this is a very simple exercise. It's called grounding. It's a grounding technique, right? What I need you to do is to ground, and I want you to practice this when you are okay, when you are doing well,
Okay.
because because when we practice, practice makes perfect, right? This is the old saying. So when we are stressed out, if we don't practice, it's not gonna work. We're not gonna know how to do it. But when you practice and practice, it's like a repetition thing. So when you practice, um, it changes the way you see things. So that, and possibly whenever you find during the day, this 5, 10 minutes, just how about you? Do you have access to YouTube?
Yeah.
Okay. Then you could possibly find, uh, just if you write 5, 10 minute wellness meditation, you will find some videos there that will be excellent for guiding you for those 5, 10 minutes. That could really help you. Um, so would you like to have another meeting that we could probably discuss, you know, uh, better, have more plans, figure out the goals, and have a more a deeper talk, get more into it.
Yeah. Mm.
Okay, perfect, perfect. Then how about next week?
Yeah, I can meet next week.
Okay, perfect. Same day, same time. Would that work for you?
Yeah. Yeah, I think so. Yeah.
Excellent. Then I'm gonna hold on. I'm gonna be writing this down real quick just for that. And we are set up for next week. Thank you very much. It's very nice to meet you.
Thank you. It was nice meeting you too.
Bye bye.